medication usage UZEDY risperidone, extended release injectable suspension for subcutaneous use, is indicated for the treatment of schizophrenia in adults. Important safety information warning: increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. UZEDY is not approved for use in patients with dementia-related psychosis and has not been studied in this patient population. Please see the important safety information later in this video and full prescribing information for UZEDY, including boxed warning, available at UZEDYHCP.com.
Hello, my name is Layla Gulen, and on behalf of NP-PA Engage, I want to welcome you to this segment of Ask the Experts. Today, we're discussing the administration and flexibility of UZEDY for schizophrenia. I'm very excited to have joining me an expert in the field. Jacquita Jordan is the owner of Fountain Valley Healthcare, an integrated primary care and mental health clinic in Colorado Springs, Colorado. She earned her Doctor of Nursing practice from University of South Alabama in 2015 and has been practicing in Colorado for 9 years. She is board certified as a family nurse practitioner, adult gerontological acute care nurse practitioner, and a psychiatric mental health nurse practitioner. Welcome, Jacquita.
Thank you. It's good to be here. I really appreciate it.
Well, let's jump right in. Can you tell us how UZEDY is given to patients?
That's one of the things about this medication. So it can be given either in the back of the arm or in the abdomen. It's given subcutaneously. So it's available in 1 and 2 month dosing options, which allows for some flexibility for the patients.
What does the preparation of the medication look like?
So you're going to want to read the full administration and preparation instructions included in the PI for the medication. But some tips for this is that you want to hold the pre-filled syringe by the syringe cap, not by the flanges. That's kind of our instinct, is to go for that flanges. You want to hold it by the cap, and you want to whip your arm 3 times rapidly with your full arm to move that bubble to the top of the syringe cap. So once that's there, then you're okay to go ahead with the administration of the medication. So you'll pinch the patient's skin either in the back of their arm or their abdomen. You're going to clean that area, and then you're going to inject at a 45-degree angle, depending on the subcutaneous tissue. And then you'll release that, inject the medication, and then you'll want to wait a full 2 seconds to ensure that the entire dose is administered to the patient. It's a small volume, so we don't want any of that to leak out. The other thing with this is that we want to make sure you don't prime the needle. That's kind of our thing that we've been taught with most injections, is that we've got to get that air bubble out of there. With UZEDY, we do not prime that medication. You don't prime the needle. You want to look at it and ensure that the air bubble is at the top of the syringe by the cap, and then inject the air and the full dose of the medication.
And what are the dosing ranges of UZEDY?
The comparable doses are from 2 to 5 milligrams of oral risperidone. And there's a handy chart in the PI that gives you this conversion, this chart, to be able to figure out that option, the dose option. So for a 1 month injection, there's doses that are 50 milligrams, 75, 100, and 125 milligrams. For the 2 month option, there's a 100, a 150, a 200, and a 250 milligram dosing option.
There are several LAI risperidone products on the market. What reasons led you to choose this medication?
So this medication comes in a pre-filled syringe. There's no reconstitution or premixing required for it. It's also given subcutaneously, which is different than a lot of the intramuscular options that are available. The needle size is really short, so it's 5/8 of an inch, and it's a very small injection volume, so less than 1 milliliter. There's no oral supplementation required for your patients, and there's not multiple injections required the day you start them on the medication. So if you decide that a patient is a good fit for this and they have established oral tolerability and risperidone, you can start the patient on it right away. It has rapid absorption and reaches therapeutic plasma levels within 6 to 24 hours. And the other really nice part about this is that the medication can be stored at room temperature for up to 90 days. So this works great for those of us that have patients that are sometimes inconsistent with showing up for their scheduled appointments.
How do you utilize this in your practice?
So for me, I work with a lot of unhoused patients or patients that were recently incarcerated. So these patients are at high risk of relapse with their schizophrenic symptoms, and I often use an LAI for these patients. Oral risperidone has been around for a long time, so these patients have usually tried it either in an outpatient setting or while they were incarcerated. And then the rapid absorption, where it's reaching the therapeutic plasma levels within 6 to 24 hours. So I can carry this with me when I go to do outreach. So I'll walk the camps and see different patients kind of in their housing situation, the tents, the camps that they're living in. So a lot of our patients are not able to get to the clinic because of either transportation issues. They may not have somebody to kind of watch their dogs, their belongings. They may not get their reminder calls if they don't have a phone. So this 2-month dosing option is a good option for them because they have to come less frequently. And since it's given subcutaneously, they don't have to expose their glute while they're out in the camps. We just need the back of their arm. And it doesn't need to be refrigerated, which is the other nice thing. So if I can't find them the day that we're out there, it gives me 90 days to keep that stored at room temperature until I do see them again. And this allows me to not have to reconstitute or premix anything, which may be difficult while I'm out on the trails. And the feedback I hear from my patients is that there's a small needle size and the small volume of medication for them.
Great. Thank you so much, Jacquita. That was extremely informative, and we're so happy that you joined us today to share your expertise.
Thank you so much. I hope the viewers found this information helpful. And now let's discuss some additional important safety information. Important safety information warning continued. Contraindications. UZEDY is contraindicated in patients with a known hypersensitivity to risperidone, its metabolite palperidone, or any of its components. Hypersensitivity reactions, including anaphylactic reactions and angioedema, have been reported in patients treated with risperidone or palperidone. Warnings and precautions. Cerebral vascular adverse reactions. In trials of elderly patients with dementia-related psychosis, there was a significantly higher incidence of cerebrovascular adverse events, e.g. stroke, transient ischemic attack, including fatalities in patients treated with oral risperidone compared to placebo. UZEDY is not approved for use in patients with dementia-related psychosis. Neuroleptic malignant syndrome, NMS, a potentially fatal symptom complex, has been reported in association with antipsychotic drugs. Clinical manifestations of NMS are hyperpyrexia, muscle rigidity, altered mental status, including delirium, and autonomic instability, irregular pulse or blood pressure, tachycardia, diaphoresis, and cardiac dysrhythmia. Additional signs may include elevated creatinine phosphokinase, myoglobinuria, rhabdomyolysis, and acute renal failure. If NMS is suspected, immediately discontinue UZEDY and provide symptomatic treatment and monitoring. Tardive dyskinesia, TD. TD, a syndrome consisting of potentially irreversible involuntary dyskinetic movements, may develop in patients treated with antipsychotic drugs. Although the prevalence of this syndrome appears to be highest among the elderly, especially elderly women, it is impossible to predict which patients will develop the syndrome. Whether antipsychotic drug products differ in their potential to cause TD is unknown. The risk of developing TD and the likelihood that it will become irreversible are believed to increase with the duration of treatment and the cumulative dose. The syndrome can develop after relatively brief treatment periods, even at low doses. It may also occur after discontinuation. TD may remit partially or completely if antipsychotic treatment is discontinued. Antipsychotic treatment itself, however, may suppress or partially suppress the signs and symptoms of the syndrome, possibly masking the underlying process. The effect that symptomatic suppression has upon the long-term course of the syndrome is unknown. If signs and symptoms of TD appear in a patient treated with UZEDY, drug discontinuation should be considered. However, some patients may require treatment with UZEDY despite the presence of the syndrome. In patients who do require chronic treatment, use the lowest dose and the shortest duration of treatment, producing a satisfactory clinical response. Periodically reassess the need for continued treatment. Metabolic changes. Atypical antipsychotic drugs have been associated with metabolic changes that may increase cardiovascular, cerebrovascular risk. These metabolic changes include hyperglycemia, dyslipidemia, and body weight gain. While all of the drugs in this class have been shown to produce some metabolic changes, each drug has its own specific risk profile. Hyperglycemia and diabetes mellitus, DM. In some cases, extreme and associated with ketoacidosis or hyperosmolar coma or death have been reported in patients treated with atypical antipsychotics, including risperidone. Patients with an established diagnosis of DM who are started on atypical antipsychotics, including UZEDY, should be monitored regularly for worsening of glucose control. Patients with risk factors for diabetes mellitus, e.g., obesity, family history of diabetes, who are starting treatment with atypical antipsychotics, including UZEDY, should undergo fasting blood glucose FBG testing at the beginning of treatment and periodically during treatment. Any patient treated with atypical antipsychotics, including UZEDY, should be monitored for symptoms of hyperglycemia, including polydipsia, polyuria, polyphagia, and weakness. Patients who develop symptoms of hyperglycemia during treatment with atypical antipsychotics, including UZEDY, should undergo FBG testing. In some cases, hyperglycemia has resolved when the atypical antipsychotic, including risperidone, was discontinued. However, some patients required continuation of antidiabetic treatment despite discontinuation of risperidone. Dyslipidemia has been observed in patients treated with atypical antipsychotics. Weight gain has been observed with atypical antipsychotic use. Monitoring weight is recommended. Hyperprolactinemia, as with other drugs that antagonize dopamine D2 receptors, risperidone elevates prolactin levels, and the elevation persists during chronic administration. Risperidone is associated with higher levels of prolactin elevation than other antipsychotic agents. Orthostatic hypotension and syncope. UZEDY may induce orthostatic hypotension associated with dizziness, tachycardia, and in some patients, syncope. UZEDY should be used with particular caution in patients with known cardiovascular disease, cerebrovascular disease, and conditions which would predispose patients to hypotension, and in the elderly and patients with renal or hepatic impairment. Monitoring of orthostatic vital signs should be considered in all such patients, and a dose reduction should be considered if hypotension occurs. Clinically significant hypotension has been observed with concomitant use of oral risperidone and antihypertensive medication. Falls. Antipsychotic, including UZEDY, may cause somnolence, postural hypotension, motor and sensory instability, which may lead to falls and consequently fractures or other fall-related injuries. Somnolence, postural hypotension, motor and sensory instability have been reported with the use of risperidone. For patients, particularly the elderly, with diseases, conditions, or medications that could exacerbate these effects, assess the risk of falls when initiating antipsychotic treatment and recurrently for patients on long-term antipsychotic therapy. Leukopenia, neutropenia, and agranulocytosis have been reported with antipsychotic agents, including risperidone. In patients with a pre-existing history of a clinically significant low white blood cell count, WBC, or absolute neutrophil count, ANC, or a history of drug-induced leukopenia or neutropenia, perform a complete blood count, CBC, frequently during the first few months of therapy. In such patients, consider discontinuation of UZEDY at the first sign of a clinically significant decline in WBC in the absence of other causative factors. Monitor patients with clinically significant neutropenia for fever or other symptoms or signs of infection and treat promptly if such symptoms or signs occur. Discontinue UZEDY in patients with ANC less than 1,000 per cubic millimeter and follow their WBC until recovery. Potential for cognitive and motor impairment. UZEDY, like other antipsychotics, may cause somnolence and has the potential to impair judgment, thinking, and motor skills. Somnolence was a commonly reported adverse reaction associated with oral risperidone treatment. Caution patients about operating hazardous machinery, including motor vehicles, until they are reasonably certain that treatment with UZEDY does not affect them adversely. Seizures. During pre-marketing studies of oral risperidone in adult patients with schizophrenia, seizures occurred in 0.3% of patients, 9 out of 2,607 patients. 2, in association with hyponatremia. Use UZEDY cautiously in patients with a history of seizures or other conditions that potentially lower the seizure threshold. Dysphagia. Esophageal dysmotility and aspiration have been associated with antipsychotic drug use. Antipsychotic drugs, including UZEDY, should be used cautiously in patients at risk for aspiration. Priapism has been reported during post-marketing surveillance for other risperidone products. A case of priapism was reported in pre-market studies of UZEDY. Severe priapism may require surgical intervention. Body temperature regulation. Disruption of the body's ability to reduce core body temperature has been attributed to antipsychotic agents. Both hyperthermia and hypothermia have been reported in association with oral risperidone use. Strenuous exercise, exposure to extreme heat, dehydration, and anticholinergic medications may contribute to an elevation in core body temperature. Use UZEDY with caution in patients who experience these conditions. Adverse reactions. The most common adverse reactions with risperidone greater than or equal to 5% and greater than placebo were Parkinsonism, akathisia, dystonia, tremor, sedation, dizziness, anxiety, blurred vision, nausea, vomiting, upper abdominal pain, stomach discomfort, dyspepsia, diarrhea, salivary hypersecretion, constipation, dry mouth, increased appetite, increased weight, fatigue, rash, nasal congestion, upper respiratory tract infection, nasopharyngitis, and pharyngeolaryngeal pain. The most common injection site reactions with UZEDY, greater than or equal to 5% and greater than placebo, were pruritus and nodule. Drug interactions. Carbamazepine and other strong CYP3A4 inducers decrease plasma concentrations of risperidone. Fluoxetine, paroxetine, and other strong CYP2D6 inhibitors increase risperidone plasma concentration. Due to additive pharmacologic effects, the concomitant use of centrally acting drugs, including alcohol, may increase nervous system disorders. UZEDY may enhance the hypotensive effects of other therapeutic agents with this potential. UZEDY may antagonize the pharmacologic effects of dopamine agonists. Concomitant use with methylphenidate, when there is a change in dosage of either medication, may increase the risk of extrapyramidal symptoms, EPS. Use in specific populations. Pregnancy may cause EPS and/or withdrawal symptoms in neonates with third trimester exposure. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to atypical antipsychotics, including UZEDY, during pregnancy. Healthcare providers are encouraged to register patients by contacting the National Pregnancy Registry for Atypical Antipsychotics at 1-866-961-2388 or online at womensmentalhealth.org/clinical and-research-programs/pregnancy registry. Lactation. Infants exposed to risperidone through breast milk should be monitored for excess sedation, failure to thrive, jitteriness, and EPS. Fertility. UZEDY may cause a reversible reduction in fertility in females. Pediatric use. Safety and effectiveness of UZEDY have not been established in pediatric patients. Renal or hepatic impairment. Carefully titrate on oral risperidone up to at least 2 milligrams daily before initiating treatment with UZEDY. Patients with Parkinson's disease or dementia with Lewy bodies can experience increased sensitivity to UZEDY. Manifestation features are consistent with NMS. Please see the full prescribing information for UZEDY, including boxed warning.